Assalamu alaikum. Welcome to all the dental personnel. I am Dr. Mizanur Rahman, Associate Professor, Dhaka Dental College. I come in live and like to share my knowledge under the heading Outline the Guidance for Dental Setting to reopen the shutdown dental clinic in Covid-19 pandemic. And what is the rationality in the guidance? They developed a framework or policy for healthcare personnel and the healthcare system for delivery treatment. Dental healthcare persons should regularly consult with the dental society, dental and health department for upgradation the policy to impact recognizing the degree community transmission, region-specific recommendation, and to protect staff and dental personnel and attendant during the dental procedure. And we should know how transmission the virus. COVID-19 is thought to be spread primarily through the respiratory droplets. When an infected person cough, sneeze, or talks, airborne transmission from person to person over a long distance, and the virus has been shown to persist in aerosol for hours, on some surface for days. COVID-19 may spread by people who are not showing symptoms. We are still learning about its spread and the severity of its illness. What are the risks in the procedure? In the practice of dentistry involves mostly use the rotatory instruments, surgical instruments like handpiece, ultrasonic scalers, air water syringes. These instruments create a visible spray and that contain droplets of water, saliva, and blood and microorganisms, other debris. Surgical masks protect the mucous membrane of the mouth and nose from the double spectral, but do not provide complete protection against the inhalation of airborne infectious agents. Dental healthcare personnel has to take a decision on the basis of dental health care setting and its facility to protect the potential direct or indirect exposure or infectious materials that present on the body surface and contaminated medical supplies, device, equipments, environmental surface, and from the contaminated air. Provide dental treatment only after assess when patients don't have symptoms related with the COVID-19. Should consider both risk to the patient and risk to the dental health personnel associated with the disease transmission. Personal protective equipments and supplies to support the patient. And we should give emphasis about the area basis transmission, minimal community transmission. Dental care can be provided to a patient with standard precaution, and moderate community transmission. Dental care can be provided to the patient with additional precaution, and high community transmission, a large area community transmission including communal setting like a school and workplace, and should consider highest protection need for both the dental healthcare personnel and the patient. And how manage the patient is very important. Contact all the patients prior to dental treatment. Health screening is to be done over telephone to all the patient's symptoms and related with the COVID-19, including cough, shortness breath, fever, chill, muscle pain, headache, sore throat, and lost taste. If patient reports the symptom COVID-19, avoid the non-emergent dental care. If possible, delay dental care until patient has recovered. Over telephone, sorting the patient and give the priority of the treatment. Assess the patient dental condition. Determine whether patient needs to be seen in dental clinic. Otherwise, advise for the tele-dentistry option. Request the patient to come along with least number visitors who is most essential. Advise patient and accompany will request to wear a face mask on entering the clinic. On arrival, the patient will be undergoing screening for fever and symptom consistent with COVID-19 and hand wash correctly scientifically with the disinfectant. Systematically assess all the patients and visitors on arrival. Advise to the patient visitor put up shoes outside the clinic. Patient can put on supplied foot cover or sandal. Ensure that patient and a visitor have wear to their own face covering or provide a surgical mask. We can spray disinfectant on dress with 0.5% sodium hypochlorite. Ask about the presence of fevers or other symptoms consistent with the COVID-19, and we can supply a questionnaire to the patient. If anyhow dental treatment is given to the patient who is later confirmed to have a COVID-19 may occur, patients would be requested to inform to the dental clinic, and this has been instructed to the dental healthcare personnel. The patient has a fever strongly associated with the acute dental problem, pulpitis or periapical periodontitis or interval swelling, alveolar abscess fracture, but no other symptom consistent with the COVID-19. Treatment can be provided with the appropriate protocols. And what are the facility in the setting? And we should take the step. The etiquette. Patient and staff should learn the respiratory hygiene and cough etiquette. Hand hygiene all the patients on arrival throughout the duration of visit. Visual alert like signboard, poster at the entrance and the study place, waiting area, elevators, or provide instruction with appropriate language about the hand hygiene and the respiratory hygiene, cough etiquette. Instructions should include wearing a cloth face covering or face masks for source control, how and when perform hand hygiene, and should supply the hand sanitizer to every corner of the clinic, the 60% alcohol or 0.5% chlorhexidine gluconate. No touch the receptacles at the entrance waiting room or the patient decks to prevent the additional infection. Install physical barrier at the reception area, glass or the plastic. Place the chair in the waiting room at least 6 feet apart. Remove all the toys, magazines and other objects that cannot be regularly cleaned and disinfected from the waiting area. Minimize the number of persons in the waiting room. Patient may option to wait in the vehicle or the outside the dental clinic where they can be contacted by mobile phone. And it is their turn for the dental care. Minimize overlapping the dental appointments. And equipment's consideration in the COVID-19 and shut down the dental clinic. All instruments are unused, should clean properly, like the dental unit water lines, drainage system, suctions, and others. Autoclaves, instrument and cleaning the equipments, like the air compressor, vacuum machine, suction line, radiography equipments, and high technology equipments, amalgamator, dental equipments should follow the protocol. Administrative management is very important during this period. Set up the operatories should clean and sterile. Instrument needed for the dental procedure should be easily accessible, and all the instruments should cover and away from the potential contamination. Any supplies or the equipments or the tray not used but exposed should consider as a contamination, and that will be disposed for the reprocessing. Avoid aerosol generating procedure if possible. Avoid the use of dental handpiece, air and water syringes, and avoid the use ultrasonic scaler and minimally invasive or traumatic restorative technique. If aerosol generating procedure are necessary for dental care, and we can use the four-handed dentistry, high evacuation suction, and rubber dam to minimize the droplets, spatters or aerosol. And pre-procedural mouth rinse like the chlorhexidine gluconate or povidone iodine can be used to reduce the antimicrobial in the oral cavity. And good air movement or ventilation is important in COVID-19 situation, and good airflow that reduce the air pollution. And heating, ventilation, air condition should be maintained to reduce the infection, and run all the exhaust fan including bathroom. We can use or consider to use the HEPA, air filtration unit, while the patient is actively undergoing the dental procedure and aerosol generating procedure. Will reduce the particle count in the room, reduce the amount of turnover time, and HEPA unit will be placed within the vicinity of the patient chair. And we also consider the use the ultraviolet germicidal irradiation. Patient placement is very important and should provide the treatment in an individual patient room if possible. For dental facility within open plans to prevent the spread of pathogen, there should be clean, easily clean area and effective portable HEPA filtration system, and at least 6 feet space between the patient's chair. What will be the patient volume? Number of patients appointments depends on the dental facility based on number of rooms, layout of the facility, time needed to clean and the disinfectant operatories, and dental healthcare personnel should wait at least 15 minutes time for droplets to sufficiently fall from the ear after a dental procedure. And hygiene. And hygiene is very important. And the etiquette should learn everybody. Strictly practice hand hygiene, including before and after all the patient contact. Contact with potential infection materials before putting on or after removing personal protective equipments, including gloves. Use 60% alcohol or soup or water for at least 20 seconds. Hand hygiene supply are available to dental clinic to every corner. We should consider the universal source control, and all the dental health personnel should wear a face mask at all the times while they are in the dental office. Surgical masks are preferable over the cloth face covering. Surgical masks both source control and the protection against the exposure to splash, spray of infectious materials from others. And dental health personnel holds job duties non-clinical, no need PP, such as the clerical personnel, but continue to wear the face mask covering for the source control while in the dental setting. Dental healthcare personnel such as dentist, dental hygienist, dental assistant may wear their cloth face covering when they are not engaged in direct patient care activities. And they should remove their respirator surgical masks and put on their cloth face covering when leaving the dental office. But should instruct the hand hygiene immediately before or after remove the mask. Face mask cloth covering can be saturated with the respiratory secretion. Healthcare personnel should take steps to prevent self-contamination and should change the face mask covering if becomes soiled or damp or hazardous to the breath through the cloth face covering, and should be washing daily. And dental facilities should provide training to dental care personnel about when, how and where cloth face covering can be used, including frequency of washing, guidance on when to replace them, when they can be worn in the clinic. Using personal protective equipments and training is very important. Appropriate PPE should be provided to the dental healthcare personnel to occupational safety, and must training on when to use the PPE, what PPE is necessary, how to properly wear and use the put of PPE in a manner to prevent self-contamination, how to properly dispose or disinfect and maintain PPE. If reusable PPE is properly cleaned and decontaminated and maintained after and between the use, and should wear surgical mask, eye protection, and full face shield to protect splashing, spreading blood or other body fluids that infected the protective clothing during the dental procedure. Then consider use the N95 mask or respirator. Respirators should be used in the context of respiratory protection program. If a respirator is not available for an aerosol generating procedure, use both the surgical mask and a full face shield. Ensure that mask is used the highest available and the quality. If not available the surgical mask or the face shield, don't perform any aerosol generating procedure. The sequence the preparation of the dental health care personnel before entering the patient in the operating room. The preparation of the dental health care personnel. Perform the hand hygiene, put on a clean gown or protective clothing, put on surgical mask or respirator, and properly tie and place the mask or the respirator, and use the eye protection, and put on the clean and non-sterile gloves, and then enter the patient room. After completion of dental cares, remove all the gloves, remove gown or protective cloth or gown, discard in a waste container or linen, discard disposable gown after use, washing, use the gown or protective cloth after each use, exit the patient room, perform hand hygiene, remove eye protection, and then remove the eye protection, hold the strap and pulling upwards from the head. Don't touch in front the eye protection. Remove and discard the surgical mask or respirator. Don't touch the in front the respirator or mask. And carefully untie and pull from behind without touching in front. And respirator, remove the bottom strap by touching only the strap and bring it carefully over the head. Don't touch in front. Perform hand hygiene. How we can environmental infection control. Dental healthcare personnel should ensure that environmental cleaning and disinfection procedures correctly, and clean the room. Wait at least 15 minutes to clean and disinfect and after dental procedures. This time will allow the droplets to fall sufficiently from the ear after procedure. Routine cleaning and disinfection procedures and management all the medical waste. This is very hazardous to the environment and the peoples. Sterilization and disinfection of the patient care items routinely have to be done. Cleaning, disinfectant and sterilization all the instruments, and safe disposal waters from the washing PP, surface and the floors. Safe disposal waters from the washing PP, surface and the floors. Utility gloves and heavy duties gloves, reusable plastic apron, clean with soap and water, then decontaminate with the 0.5% hypochlorite solution. Additional precaution has to be taken. Patient arrive at the dental clinic is suspected or confirmed to have Covid-19, delay the dental treatment and take the following action. Advise the patient to wear a face mask. If any emergency dental care with the Covid-19 should fall including use PPE, dental treatment should provide individual patient room with closed door, avoid aerosol generating procedure. Aerosol generating procedure if performed must take extra precaution. Dental healthcare personnel in the room should wear the N95 or higher level respirator, eye protection, goggles or the full face shield, gloves and gown. Limited number of dental health personnel present during the procedure. Visitors should not be present for the procedure. Aerosol generating procedure should ideally take place in an isolation room. Don't schedule any other patient at the same time. And the last consideration, the test. If a suspected case, we can advise for some test. Monitor and manage the dental health care personnel is very important. Should be asked regularly monitor themselves, fever and symptoms consistent with the Covid-19. If any person with fever should be reminded to stay home. If aerosol generating procedure must taken with the precaution, wear 995 or high level respirator or eye protection or full shield, gloves or gown wearing. Education and training. Provide the dental health care personnel should have education and training on the preventing transmission of infection and training on basic aspects for safe care. And they are educated and trained, have practiced appropriate use of the PPE prior to caring for a dental patient, including attention to correct use the PPE. And last of all, I'd like to say that with the pleasure, Bangladesh Dental Society already working to prepare a national guideline to reopen the shut down dental clinic. And also the Director DG Health come forward on this regard. And thanks to everybody, patients were